Let's try this again.
He's so cute.
If you guys have followed us like on Threads and all these other places, you'll see that he's pretty much become our official, unofficial dog
He's
at
so
this
cute.
point.
Like he keeps me warm.
Yeah, he just wants attention. If anybody out there has a lab or anything like a lab, you know that they just are attention hogs.
I
But
know.
anyway,
So cute.
we attempted to start this episode and then
We were both very confused on why the space looked so clean.
everything
and
looks clear. And then I realized I didn't set up the microphones.
And I didn't notice at
Neither
all.
one of us noticed until I was like actively telling my mind because I've already
Julie
made
noticed
it.
though, but she even asked me. She's like, "Sup, like, what are we missing?" And I was like, I have no idea.
Well, but I noticed it already recording and I'm like introducing the episode and everything. And then I'm like, wait a minute, I got to move closer. And I'm like, you idiot, you're moving closer to what? There's nothing. Anyway,
To what?
so we're here. And like I was saying in the blooper that I'm sure you guys will see in social media because that was an awesome blooper. We're going to be talking about AI and medicine.
Yes, super hot topic now with medicine. Lots coming out with it.
Yeah, I mean, in the practice of medicine and teaching medicine, it's just everywhere. I mean, AI is just going to become like, I think, well, I talked about it with Adrian. He's a friend cop of ours, and he's into IT. He has his own IT company and everything. He's just boss manning it out there. Anyway, instead of boss girling, boss manning.
Boss Manning.
I'm-
I like that.
I'm all over the place today. Anyway, yeah. Okay, so since he's into IT and all that, I wanted to talk to him about it. I'm like, you know what? Let me pick your brain on this. Because a lot of people out there are like, man, AI is going to take over the world. It's going to take over like all the jobs. Everybody's freaking out and scared of AI. And I'm like, let me ask him. Like, if anybody would know, like, it'd probably be Adrian. And he's like, honestly, I think it's going to become like the next computer. Like, you remember back, well, we lived it, us millennials, any millennials out there, when computers came out, everybody was saying the same thing. Like, oh my God. He's like, remember how everybody was scared of computers at first? The same thing. They're going to take over. Nobody's going to have any jobs left or whatever. And what computers did was just amplify our lives.
Amplify everything.
It helped us out in every
Especially
aspect.
during the pandemic.
Absolutely. So I agree with him. I think AI is going to be like the next computer revolution of like now and we're seeing it now in this AI and medicine, how it's just going to help us out. It's going to make us better at all these things. And one example, which we're going to talk about, is in medicine.
Yes. It's like a big topic in medicine,
Yeah.
and some people are kind of scared, because the same scare that happened with, everyone saying before that, here we go, the eyebrow. I can't even concentrate because I'm like physically trying to like not raise this eyebrow.
That
Just gonna
Evie,
talk like this.
Evie just has this thing that she wants to control
My left eyebrow.
her left eyebrow because she says it has a mind of its
It
own.
does have a mind of its own.
If you guys heard our episode on alien hand syndrome, she believes she has eyebrow syndrome. No, alien eyebrow syndrome. And I think it's cute. I think it's part of her character. It's very
It is part of my
expressive.
character, but goddamn, like all the time, like calm down.
She's
But the thing is that like, I never knew this until we started filming. So I'm sure I cannot be the only person that people look back on their videos and I'm like, wow, why do I do that?
oh,
all the
100. I do that
time?
all the time. I'm the one that edits our videos. Trust me. I see a lot of my shit too.
Yeah,
And I'm
whatever.
just
Well,
like-
alien hand. What are we gonna name her?
Oh, I don't know. What do you want to name her? Has to be something with attitude, something with spice, something
Bichota. I'm gonna call her Bichota.
that's spicy. Bichota. Okay.
She's like a boss, Bichota.
Isn't she like a reggaeton person?
It's Karol G.
Oh, that's her.
She's a Bichota, yeah.
Okay. Anyway,
Right? I think that's what they call her, Bichota.
I don't know. I don't listen to reggaeton. You know me. I know there's somebody called Bichota,
Hold on.
and any Puerto Rican that's listening to us right now, they're like, "Oh my God!" They keep saying that word. I'm sorry, we don't mean it in that way.
Bichota.
Yeah.
An individual who, due to it's basically a he thing, but she made it a her thing.
Right.
Because it's bichote. So bichote is an individual who, due to his economic or political position, is considered more important and influential than any other person. So she just named herself Bichota. So she's Bichota. All right, well, anyways. So AI, like Adrian was saying, or your conversation with
Yeah.
Adrian, is that before we used to really be afraid that it was going to take away jobs because
Yeah.
computers were going to kind of like take over the world and stuff.
Yeah.
And there's a lot of physicians that now are kind of like,
Yeah.
not that they're going to take away jobs, but it's, going to affect,
Right.
jobs. But there are so many good things that we're going to be discussing
Yeah.
as we scroll through the podcast.
Yeah.
There's a lot of good things that come out of AI as well.
Yeah.
And we'll kind of talk through it as our points.
Absolutely. Yeah. I mean, I think we're of the mind, and everybody has their own opinion on this, but I think we're both on the same mind of it's gonna just help.
I think it's definitely gonna. I think I can see both sides.
Yeah, definitely.
I can see both sides on how maybe I think a lot of people, it's almost, I guess like the way that I like to put it is like Dr. Google.
Yes.
So
Yeah.
there's Dr. Google and now we have AI.
Yeah.
So it's like the doctor to go to. You know what I mean?
Yeah, that you're gonna start getting patients like, oh, Chat GPT told me that because I had this headache,
Yeah.
I have this or whatever.
Which is not technically wrong.
Yeah.
You know what I mean? But it's like, was your follow-up question like, how common is this?
Yeah, there's just a lot.
There's just a lot that goes into it.
Yeah.
However, the new AI in medicine, it's really geared like towards healthcare. So not so broad as like a Chat GPT. So I think it is going to be helpful in the sense that I think clinicians or providers, doctors are going to be more efficient
Yeah.
with their visits, and it's going to improve the efficiency of it. So let's say if it
Right.
takes me 10 steps to get from point A to point B in your
Right.
diagnosis, maybe AI, instead of 10 steps, it's going to be like 5 steps. So it's not terrible.
Well, I think it's really, really gonna help you guys in the efficiency area with EMR. Because you guys spend so much freaking time taking notes, writing, like documenting, that I feel that is where it's gonna come in and save you guys so much.
You know what's crazy is that our documentation
Yeah.
has been even more limited because the volume of patients is so much. So our documentation naturally goes down because it's impossible to document everything.
Yeah. Yeah.
So we document the highlights,
Yeah.
basically, and things that are pertaining to that visit.
Right.
However, our documentation is slowly but surely like just getting less and less and less, because then now, because of EMR, we have to document other things that we didn't need to document before just to meet measures.
Yeah. Okay. Understood.
So, and that could be for billing, that could be for insurance, that could be for like all these things.
Yeah.
So like, for example, if an adult goes for their regular annual visit, you have to document that you talked about smoking cessation.
Okay. Yeah, for insurance.
For insurance purposes, exactly. So then, like for me, in a general example, is every 2-year-old and up, ages 2 to 3. I think they're gonna start doing it for 2, but I think for now it's age of 3 and up. I have to document BMI and that I discussed exercise and nutrition counseling.
Interesting.
I have to document it into my note.
Wow.
Yeah.
Okay. Yeah. So you see.
So it's like little things like that. It's like the patient came in for constipation, but yes, I documented it. I did nutrition and exercise counseling on their BMI and stuff. Yeah.
So you see those type of things. If there's a way to integrate AI to save you all of that tedious time that's taking away from you interacting with the patient themselves, I think that would be fantastic.
Yeah.
So I don't know. I mean, AI is developing so quickly every day. That's more and more and more that one day it's going to be integrated into the EMR system some way, somehow. I think it actually is already with patient records in some hospitals, very, very few, just in organizing and data collection of patients and whatnot.
Yeah. So back in 2020, Microsoft bought Nuance, which is basically it's the AI kind of world in healthcare.
Oh, okay.
And then now recently they just came out with DAX. It's Dragon Artificial something like that.
Okay.
Ambient. That's what it's called. Dragon Ambient Intelligence. That's what it is. So basically, DAX is a patient comes in, right? And you have to obviously give permission that you're going to be recording them. But
Right.
basically, what it does is that it records our whole entire visit.
Oh,
And then it writes our note for us.
nice.
Yeah.
Nice.
And it's not what's even crazier, which is, I'm telling you, like science is advancing so much. And this is where I feel like it can really help us.
Absolutely.
Is that right after, like immediately after the visit is over, this AI system will write this note for you. Okay. But not like every single word. Like it summarizes like what you talked about, getting rid of like little things. So it's not like extra
like filler words
and stuff. And then on your assessment and plan, it like gives you, oh yeah, so like for this headache, based on what you discussed with your patient, maybe you would suggest a CT,
That's
you know,
incredible.
something like, something like that, or a neurology consult or something. So it's literally like almost like setting it up already for the physician to kind of like
pick and choose.
pick and choose and be more efficient, and then maybe even bring up studies on like why you would want to get things.
Awesome. Oh my God, I love that so much.
Yeah.
Because that definitely makes you guys more efficient.
Yeah.
You
The
have
only
to-
thing that I see that's like maybe could be a little bit, and we'll talk about it. We're like going off on a tangent. We haven't even started we haven't even read our first bullet point. The only thing that I can see with AI though, in that certain situation, which is what I'm afraid that can happen, is that when you have a patient and they come in for something, maybe there's one little like red flag word that the patient says that you hear and you're like, but you clear it up in a certain way, but the system picks up that red flag word and then like tunnels you into like this certain diagnosis.
Okay.
So then I feel like that couldn't lead to unnecessary testing and stuff like that. Maybe it's something that's like so new.
Yeah, and there's got to be a way for like settings wise for you to make it maybe more general, or for you to tunnel it more or less type of thing. So, I mean, it's so fascinating. That's incredible.
It's so crazy.
Yeah, the fact that it could write your notes, like that's awesome.
Yeah, and a lot of physicians have come out to comment on it. The people that are using it. I personally haven't used it in my clinic setting, but there's other physicians that have reviewed it so far, and they say that it's actually really nice because it also catches like certain parts of a conversation of your patient that you wouldn't have documented before. Like the patient went on this, you know, vacation with their family and stuff like that. And it's like on a regular note, I'm sorry, like I don't have time to write about that we talked about your vacation, but this AI incorporates it into the note like, oh, so we discussed this and this and this and that and blah, blah, blah.
That's so cool. That's so cool. Yeah, honestly, that's why I think that AI in the future, of course, like we're going to talk extensively in medicine, but in other aspects of our lives, it's just going to help us, just like computers are. I can't imagine a life without a computer now, with our iPhones.
My phone,
I can't. So, you know, so we're going to probably, our kids are probably going to be like that. I can't imagine my life without AI.
Yeah.
You know, so it's, I don't know. Anyway, so finally jumping into the episode.
For real. It's just 15 minutes in.
Yeah.
But fuck it.
Yeah. And that's not even counting the blooper. Anyway. Go ahead.
Okay. So, AI in medicine, it's a broad term that refers to the use of artificial intelligence techniques and applications to improve healthcare outcomes and patient experiences. AI in medicine can also help diagnose, treat, monitor patients, but also pose ethical and practical challenges, which is kind of like what Julia and I were kind of discussing right now.
Exactly. I mean, that's like the big hesitation, like how to make sure that there isn't an ethical like problem.
There's going to be,
of course
there's going to be ethical problems. You're talking about artificial intelligence. So there's going to be something in there that you need some sort of human to
100%.
So disease detection and diagnosis, AI can basically help analyze medical data and images to detect signs of disease or conditions that might be missed by human doctors. For example, AI can help identify lesions or tumors in CT scans, X-rays, MRIs, or monitor vital signs of patients in critical care and alert clinicians if there's a risk of sepsis, which is basically infection in the blood, or other complications that can happen.
Yeah.
So I think that's pretty useful.
Yeah, I think so too, yeah.
I'm going to give one example. There's a very close family friend of ours that went to the ED, right? Because she was making paella and she swallowed a piece of shell from the clams. Right. So I guess she didn't clean the clams correctly and then ate a piece of shell, but was lodged in her esophagus.
Oh, crap.
Yeah. So what ended up happening is that she felt that she had something stuck in her esophagus, and it was like, actually, she was like kind of almost choking. So she had to call 911 and they came and took her to the emergency room. They did x-rays, and then the physician at that time was like, well, I don't see anything. And she's like, I'm not crazy. I can feel it in my throat. And then he was like, okay, well, tell me exactly where you feel it. So she points. When the emergency room doctor went back, he's like, an x-ray, certain things are going to light up, certain things are not going to light up.
Okay.
However, when he went back and looked specifically where she was pointing at, deeper, he saw that there was almost like a little bit of a change.
Wow.
So tiny.
Yeah.
And he looked at it and he talked to radiology, and he's like, no, that's where it's stuck.
Yeah.
We can actually see the changes of the tissue around it.
Oh, man.
So I feel like in this sense, AI would be like, there's something
there it is.
here.
Yeah.
Ding, there's something here. Don't miss that. Even if it's just for the doctor just like to look and see and just be like, no, that's nothing.
Right.
But it's something that AI can detect and say, hey, this is abnormal.
And then she and the doctors would have saved all that time of the back and forth of like, no, I promise
More
it's here.
efficiency.
Exactly. Amazing.
Yeah, so that's just like one story where I can say that like it's very helpful. However, then I think about other situations. Like there are people that get MRIs and there's like little spots on the MRI that might light up, and it's very, what we say, non-specific.
Okay.
So it's non-specific. It's nothing really to worry about. Nothing that we should probably in the future need any repeat imaging unless you start having like symptoms or something. But so I'm sure that AI will be like, hey, this is like signaling in this MRI.
Yeah.
We picked up this like abnormal signaling. And then it's like, what? So I can just see it like kind of, going crazy, like a snowball effect,
Yeah.
So, but at least, you always try to look at things the way that you're going to improve, right? At least it triggers you to at least review those abnormal spots.
I agree.
So, and then it's your job as a physician to tell your patient, hey, I did review these things and all of that, and it's fine.
Yeah, absolutely. I think efficiency is going to be where it's going to like skyrocket.
And what I want to know, and we'll talk about it after. Okay, I'm gonna save my questions for after, because this is what I like about this podcast. We start talking about these things, and then I start asking myself questions, and then I go into like off the deep end. So other things with AI, personalized disease treatment. So AI can help provide customized and precise treatments for patients based on their genetic, environmental, and lifestyle factors. For example, AI can help recommend the best medication dosage and therapy for a patient with a specific type of cancer or rare disease. And this could be so many different things. The example in this situation, like a vignette, is basically cancer patient.
Right.
Which I can say like that's probably really good.
Yeah.
In the sense that there's so much research and new things coming out with cancer and all these things. So is AI able to kind of just bring everything together in a way where we have everything almost available right in front of us? It's like, if you have a patient, you're like, oh, I remember reading something. And then it's like, boom, right there.
That's it.
So I think that can help a lot. And then honestly, I think about it in other ways too. Like I have a patient that has XY disease and they failed XY treatment.
So then what?
Yeah. Sometimes maybe do I need a specialist to get maybe further recommendations, and then maybe AI is able to help me while I wait to get the specialist involved.
Exactly.
So it's those type of things that sorry, my friends are texting me about like CME, continuing medical education. So it's those type of things that I think about that it would be extremely helpful.
Yeah.
We have now like e-consults. So basically if a patient comes into me, I don't know, for a rash, I can take a picture of it and then e-consult a dermatologist and they can look at it and then at least give me some sort of treatment or guidance while we wait for them to see it in person.
So it's like kind of like telehealth.
Yeah, it's like a telehealth.
Yeah.
Exactly. But it's like nice because you get the consult in 2 days.
Immediate. Well, yeah, not immediate, but yeah, a lot quicker than having to wait for an appointment or whatever.
No, and it's so nice because sometimes these specialists are so good with these e-consults that they send me articles and they send me like current guidelines and stuff like that. Yeah. I had a sickle cell patient the other day that was like newly diagnosed, and I know how to manage sickle cell, like, you know, primary care wise, like vaccines, starting penicillin, all these things. But, you know, parents have certain questions, and I myself have certain questions, and I'm like, that's definitely a question for the specialist.
Yeah.
So I'll go and I'll consult them.
Yeah.
And then they'll be like, no, yeah, you're doing everything correctly. And then you can do this. And they're like, here are current guidelines specifically on this topic.
That's awesome.
Yeah. So
yeah. I mean, that's why I'm saying like this is gonna be like that.
This is gonna be very
on steroids almost, like, you know.
No, immediately.
That's what I'm saying. It's immediate.
Like right after the consult, I'm gonna have everything there.
Yeah.
You know?
Or even during the consult, this is the history of the patient, you know, whatever, allergies, whatever the heck, and then it kind of like funnels down like your options and treatment plan or whatever. It's awesome. Anyway. Clinical decision support. So AI can help doctors and nurses make better decisions, literally what I was just saying, by providing them with relevant information, research, or guidelines. Exactly what she was just talking about, but it's going to be like immediate on your hand during your consulting the patient even. For example, AI can help suggest the most appropriate test, diagnosis, or treatments for a patient based on their symptoms, history, or evidence. Clearly, I wrote these notes.
It's so crazy how we talk about all these things and then it's like bullet points right after.
It's like, God damn it. Like, why? I went ahead of myself. Like, clearly. Anyway, healthcare efficiency and quality, as we keep on saying and reiterating how much this is going to like just help and explode efficiency for you guys.
Yeah.
Mostly that you guys are, what's the word for, especially in primary care, like you're a pediatrician, so you're considered primary care, Mario, family medicine, or whatever. Not dwindling numbers, but there's like there's a deficiency. There's like a need.
Yeah. There's definitely a shortage.
Wow, I can't think of the name shortage, the word shortage. But there's a shortage of primary care, and you guys have such a volume of patients.
It's insane.
It's such a volume of patients that anything to help you guys be more efficient will help you guys be a better doctor.
Yeah.
You know, at the end of the day.
There's sometimes that I'm a little bit afraid of that though, because sometimes the word efficiency translates to, oh, well, if you're more efficient on one side, that it gives you more work for the other
I
stuff.
could see that. Yeah.
So that's why, you know, when a lot of people say like, this is going to make you more efficient and all these things, I'm like, that doesn't mean that. What does that mean? What does that translate into? Like more patience, more workload, more is more.
Yeah, exactly. What is the asterisk with the efficiency?
Exactly. So we'll see. I don't want to be the negative person and thinking that this isn't.
But you're right. And mostly, I mean, people that are listening to this in corporate America, they're like, yeah, that's a red flag right there.
So they're like, well,
yeah.
you know, it shouldn't take you this long anymore to do this thing. So that opens up your time to do this. And then it's kind of like a vicious circle.
Understood. So. Yeah, that's true. Well, hopefully efficiency and quality.
Yeah.
That's what
quality.
That's important. So AI can help improve the workflow and productivity of healthcare professionals and systems by automating tasks, which is what, I mean, if you guys could just have those tedious little like, check, okay, for insurance, this is for billing, you know, whatever.
Yeah.
If that could get out of your workflow, that'd be amazing.
Yeah. And then I also think like, how are insurance companies
they're already
be affected?
But they're already using AI.
I know, but my problem with a lot of insurance companies is that I will get a call from them saying, hey, I see that you prescribed this medication, but you never documented that the patient failed this other medication, which in order to get this medication covered, they should try this medication when we already know that it's going to fail.
Yeah, it's so useless.
You know, so it's wasting time.
Of course.
So then I'm wondering like how AI is going, you know, like so basically a lot of physicians, our argument is we are arguing with people that didn't even go to medical school.
100%.
And so you're telling me how to manage my patient,
Yeah.
even though you never went to medical school.
Yeah.
So now what I'm afraid is that, well, AI, says this and this and that, blah, blah, blah.
Okay. I see what you mean. Okay.
There's a lot of things that I think about with AI. So it's I'm not saying that this is what's going to happen.
No,
It's
but
just
possibilities.
this is what's sparking conversation.
Absolutely.
And stuff like that.
And that's how you gotta make things better, by sparking these conversations.
Yeah.
That's the only way to try to align this to a good way. To a good path.
Yeah. But maybe not. Maybe the reverse will happen. Maybe through AI and articles and information and stuff like that will be more it's going to be much quicker to tell hey, actually there's a lot of studies showing that this is not going to work.
Exactly.
So,
hence why a physician went towards this route.
Yeah.
This is the data for it.
But we'll see.
Yeah, we'll see. Time will tell.
Maybe I don't have to do so many appeals.
So like I was saying, automating tasks, reducing errors, that's a big one, and optimizing resources, for sure, another big one too. For example, AI can help transcribe medical notes, as it's already happening with what Evie just said earlier in the episode with that system. Schedule appointments, that would be great. Process claims, you were just going on a rant on that. Or manage inventory, that too, which is a big problem in a lot of the clinics and stuff like that, trying to be on
Keep
top
up
of
with everything.
Exactly. All those tedious little things that you just don't have the time for.
Yeah. And it's helpful when you have a clinic, when you're seeing patients, you need to run your numbers every single day. How many patients did we see? How many of these got, I don't know, COVID tested? How many of these were prescribed medications? How many referrals did we place out today?
And AI could just immediately just pop those numbers out for you.
in. Yeah.
Amazing. Yeah. Okay. AI can help expand the reach and availability of healthcare services to understand remote populations by providing virtual or mobile solutions. For example, AI can help deliver telemedicine, chatbots, or self-care apps that can provide diagnosis, treatment, or advice to patients who lack access to doctors or facilities. That's awesome.
Yeah.
That's amazing, because
for rural areas, this is going to be a huge game changer.
Big time. And then that time, that you went to, what was it, Guatemala or something like that? If you guys had the help of chatbots, for people there, since it's not a lot of you that go to these places, you could increase, in essence, a little bit your numbers, by adding this. I don't know. It would be great either way, but...
Yeah, no, and these rural areas, they just don't have access to medical care. So basically, sometimes what ends up happening is that it's just one doctor for a whole entire town. And it's just a lot of work. And so maybe what can happen is that AI will help us kind of, I don't know. That's going to be
further
something,
reach.
Reach out and stuff. But at the end of the day, what does that really mean though? What? So if you tell an AI, oh yeah, I have ear pain and I have a fever, what this? So you're going to prescribe amoxicillin? You know what I mean?
Well, that's why it would probably be I pictured in my mind, like you said, one doctor in a small town, right? And then let's say this, ear pain or whatever. And then he or she doesn't really know what to do at this point. So it'll consult AI. AI will give him or her hey, these are the possibilities or these are the actions to take, maybe, pretty much like a consult, and then they could review it. But I think it would be a slippery slope to let AI do the diagnosis.
That's what I'm saying.
Yeah. I think it would be good to advise, to consult the doctor, but not to give the full-on diagnosis.
Yeah, exactly. I can see this a lot, with people, even for areas in medicine that are heavily overwhelmed. So psychiatry and psychology and mental health, these are appointments that will take months to
100%,
get into.
100%.
And so maybe AI can help kind of alleviate a lot of that, in that maybe a person that's doing more general medicine is able to take care of these type of patients.
Right.
So might be something.
It might be something. Well, you know that now there are chatbots that, it's become a little bit of a thing. I don't know if it's a good or a bad thing, but it's kind of a bad thing in the world of psychiatry, because then how do you deal with these people that are developing emotional like connections and relationships with AI bots?
Yeah.
So it's like these apps. I haven't explored that too much because it wasn't part of this episode, but now we're on this tangent. So I'm going to finish this statement. But there are apps out there that you could download and whatever, and then you pick and choose. I don't know, you want male, female, or non-binary. And then they look certain way. They have this certain attitude. You just customize the crap out of it. And then you start talking. You start talking to this bot, to this AI, and it's just a chat all the time, however long you want to talk to this thing. And there are people that have gone so down that rabbit hole that they now feel like a friendship or even more than that with these AI chat bots, whatever.
It reminds me of that
so-
episode of Black Mirror. Did you ever see it?
I love
the girl
Black
that her husband passed away.
Yes.
And then
Yes.
it was like a program, like an AI program that would start talking to her. So, and would write like him, would tell jokes like him. And then she wanted to have like phone conversations, and they did that too.
Yeah.
To the point where they sent her a whole entire
That's crazy.
like dummy that acted like her husband. Terrible.
It's
Creepy.
Yeah, and it's just like how it's not natural. I mean, it's horrible because we've all experienced grief in some way, somehow, but like it's just not natural.
Yeah.
Like, I mean, that's not real. You know, it's
But it feels real.
exactly, and it interacts with you real, and then you don't get you stay stuck in that denial point.
Your line of reality versus
It's not even blurred.
Not-
it's
yeah,
just
it's-
not. It's non-existent.
Yeah.
At that point. Yeah. It's rabbit hole. Anyway,
where are we going with this?
I don't know. I don't know how we got here, but like it's just so much.
I know.
To talk about in this subject. I mean,
Yeah.
that kind of is medicine, because then you got to treat those patients too. Like psychiatry wise, how do you deal with that
Yeah.
psychologically?
Not only that, but
Is that a good or a bad thing? Because maybe some people think it'll be a good thing.
yeah. No, the
I
other
don't
thing
know.
that I was
I don't know.
The other thing that is also comes into question, if AI is going to help relieve so much of this like influx of patient, be like more efficient, then like where's the specialty? You know what I mean? Like, so before
You're right.
so now I'm doing the work of another specialist because the AI, the artificial intelligence is helping me. But at what point can I, just at what point, like, where do I know? Like, where's the line that I cross that I'm like, no, I need to, AI is not.
My mind has been blown. I'm going to put like a little mind blown emoji right over here. Oh my God, that's right. So you guys primary care could just do everything now.
I mean, I wouldn't be able to.
No, I know, but like,
No.
but if we're talking
But if
about
this
like
is
in
what
that-
they're saying, that you
Exactly.
can have more help in certain places that don't have these sort of specialists.
right.
You are technically like, and everyone is different. Like I have a lot of friends that are in family medicine that practice in rural areas, and they do a lot. I'm talking to you about like births,
Everything,
like
yeah.
everything,
Yeah.
peds,
they're the
neuro,
one-stop shop.
psych. Yeah. They do a lot compared to maybe a person that lives in a more urban setting and then has access to these
Exactly.
specialists. And
Yeah.
then they're like, oh no, I don't do that. I know a lot of pediatricians that are like, I don't prescribe ADHD medications. And I'm like, I do. Like,
Yeah.
that was part of my training.
Yeah.
You
Yeah.
know? But
for them, they'll
but
be
for
like,
them,
no.
they're like, no, I don't really feel
psych or
comfortable.
whatever.
And then, or they're like, yeah, I kind of started it, but they're not comfortable yet. So we are kind of blurring those lines and kind of stepping into certain specialties. But if AI is really supposed to advance it so much, like, where do I know?
Yeah.
Like,
where's the line?
Where's the line? Like, how comfortable am I or into trusting this AI, you know?
Yeah. That's oh man, this is gonna change a lot in medicine.
Yeah.
Okay.
So medical education and research, AI can help enhance the learning and discovery of medical students, professionals, researchers by providing them with interactive and adaptive tools, data, insights. For example, AI can help create realistic simulations, virtual reality, and augmented reality environments that can help train or test medical skills, knowledge, or scenarios.
Super cool.
I can just, when I read this in the show notes, I just imagined me as a medical student
I know.
with virtual reality on with a real patient,
Yep.
like practicing.
Yep. Isn't that amazing?
That's pretty sick.
That's amazing.
That's
Because I remember when Mario was taking, at least back then, there was a portion of your steps, right, that you had to like some clinical something or
no,
another,
no,
right?
yeah. Which I can't believe.
Now that's going to be different now.
No, it is done. It is eliminated. Like medical students do not have to do the physical portion of their boards. So we had our first exam. Yeah, we had our first exam. Then our second exam was part written,
Right, I
and then
remember that.
part physical. So we actually had to go to a center. We had patients, like standardized patients, and they had like real problems,
Yeah.
these patients.
Yeah.
So we would have to write about it. They would present us with a clinical vignette, which is basically a 41-year-old male with abdominal pain and I don't know, blood in his stool,
Yeah.
or something. So then we would go and we would have to go and do these type of like workups like on the patient.
Yeah.
And then we would have a certain time, like a certain number of minutes, maybe like, I don't know, 15 minutes or something like that.
Uh-huh.
And then go and then outside and then sit and write the note. We had like 9 minutes to write the note. And then we had to give our assessment, which is basically the summary of our thinking, and then provide 3 of our top differential diagnoses. So the 3 of the top things that it could be, and then our plan,
Damn.
all in 9 minutes.
Wow.
And now
Yeah.
that's gone.
It's gone now.
So now like students don't have to do that at all, which to me is insane. I was like, what? Like how do you know
But
how
that's
they interact with a patient?
That's why that's so different from you guys to now. Like, why would you do that? Why
But
would you eliminate that?
COVID was a big thing in that. COVID was a huge thing in
Okay,
that.
fine, but COVID restrictions
like-
are no longer around, okay?
Yeah,
So
no, but it
let's
never
go
went back. It never went back.
That's BS. In my opinion, my humble non-doctor opinion, that's BS. Because like you guys were put in the ringer. You guys had to prove that you guys were capable of handling in-person patients, which is the reality of your job.
Yep.
And then how are the new generation of doctors not being tested for that? That's a huge part of your job. A huge part of your job is the person-to-person interaction.
Yeah.
That is literally what you do.
Yeah. And then it was our third test. So then a lot of things have changed. Now they eliminated the physical part. Now the first exam is a pass fail, which used to not be like that either.
I know. You guys had to like kill yourselves to get
A
like,
score, and then average scores for average
Exactly.
specialties and all these things.
such
And now
shit.
it's just pass and fail.
when we heard that, we're like, what the fuck? Because you were like Mario too. You guys had the score, the actual score,
Yep.
to compete for.
No, and I had to, like if I wanted a certain specialty, I
You
had
had to
to
have a
get a
certain
certain
amount.
score.
I can't. No.
And now it's
not
pass
going
fail.
there. No, not. I'm
Okay.
Not, I'm not gonna get into that.
Okay.
I'm not gonna get into that. Anyway, where were we?
Anyways, so
Yeah.
yeah. So we already talked about like medical and research. So back to that. I can't imagine being in like a virtual reality and
Oh
having
my
a
God.
like a patient simulation.
Yeah, like with the meta
Yeah.
goggles or whatever.
And
like,
it looks real, and you have
Amazing.
a
Amazing.
patient simulation,
Yeah.
and then you're like, I don't know, running a code, like doing all these things. Like those are things that
have you ever done one of those virtual realities?
I've never done a virtual reality, no. But
I'm obsessed.
I've seen videos and stuff, and
Girl.
it's insane. Like it looks real.
It's ridiculous. I did it in Austin back when we lived in San Antonio, and
Yeah, you feel like you're there.
I'm
Like, it's-
obsessed. I thank God I don't have that here in my house because I would probably live in that video game world.
Yeah.
I would because so it was I don't remember the name of it, but Mario and I went to it in a span of I think it was 4 nights that we were there in Austin. We went to it 3 times.
Oh my god.
That's how much we liked it. Okay. Anyway. And they had different video. I think it was 4 or 5 video games that you could do it. Girl, they strap you up, at least back then. This was like maybe 2 years ago. It was like a book bag type of situation. And then this like head goggle thing, whatever. And then if you were playing like a shooting game, the gun. If you were playing something else, it was like an axe. And then there was something else that was like a pirate game. And then that had something different.
Yeah.
Whatever. And then they had like these little ball thingies for the computer to know where you are.
Yeah.
And that was in your hands, in your and in your feet and in your head and whatever. Girl, it was accurate. Like, I was killing zombies left and right. I felt like I was in that haunted mansion for sure. And it was a room. So the room was like with these blocks that you can't pass, like this boundary or whatever. But
I'm sure it's like set up. Yeah.
Exactly. But you're moving throughout that whole room.
Yeah.
And then that room in the virtual reality, you enter different rooms, you go in and out,
Super crazy.
it's insane. Mind blowing how real. Once I had those things on, I was in there.
Yeah.
I was totally in there. So for that to be like this now that you are in a room with a patient, it could be anything.
Yeah.
Anything could be happening. You could even do like surgery.
Yeah.
Or like
you could practice
procedures or something like that. Oh, do X, Y, and Z procedure and you're there. You could virtual reality that procedure.
Yeah.
Mind blowing.
Insane.
Mind blowing. Anyway.
So AI is rapidly evolving, and it's a promising field that can offer many benefits to patients, providers, and society. However, it also faces many challenges and risks, such as data quality, privacy, security, biases, ethics, regulations, and human AI interaction. So this is kind of like what we were talking about before. There needs to be a human there. Like, it's not, we don't live in a digital world.
No,
it's
just not,
And like how you can't train artificial intelligence on ethics. You know what I mean? Like, you can train it in a sense that you can read it and you can explain certain situations and what the right thing should be.
Exactly.
You know, but not everything is clear cut.
Unless they become self-aware.
I have so many situations at work where I'm between a rock and a hard place.
Yeah, 100%.
And I know what the right answer is.
Yeah.
But that's but it's not that easy.
No.
It's like the Notebook that she's like, it's not that simple. That's literally me at work sometimes. It's not that simple. So
ADD at its best right now.
Yeah. I was just thinking, it's not that simple. Crying, because I'm definitely crying at work. It's not that simple. Anyways, okay.
So some examples of how AI is currently being used right now in medical schools, as we were talking about. The possibilities are pretty endless, but there are virtual environments. It can create a realistic simulation, virtual reality, or augmented. Here we go. There you go.
Take a shot.
Oh boy, no, don't. You'll get alcohol poisoning. Augmented reality environments that can help students learn and practice medical skills, knowledge, or scenarios. For example, AI can create virtual patients that can mimic real symptoms, conditions, or responses and allow students to interact with them and test their diagnostic or treatment abilities. AI can help evaluate the performance and progress of students by providing them with feedback, guidance, or recommendations, which that's pretty awesome. You know, for example, AI can analyze the verbal and nonverbal cues of students during simulated patient encounters and provide them with suggestions on how to improve their communication, empathy, or professionalism. Okay. I mean, that's a little rough because that's like your personality has to go into play there, right?
Yeah.
Like, I mean, that's a human thing there, but
if they're saying that AI is telling you how to like improve your communication, I guess the only thing that I can say that could be a positive there, because again, like a lot of these things, it's very objective.
Yeah.
You know what I mean? Like, I cannot teach you.
Right.
I can tell
Empathy.
you exactly.
Yeah.
Like, I can tell you what's right or wrong, but it's not, it's not black and white. You know what I mean? There's a lot of things that go in there. So at the end of the day, the only thing that I can say that with this, that it can teach you how to communicate better, is that it's almost maybe better that it's standardized.
Right.
So everyone is getting the same.
That's what I figured.
Like, advice.
Yeah.
However, then I think about like my experience, like with my attendings and stuff like that. Everyone learns something different from an attending.
Okay.
I trained with this person and, they taught me how to do this, but I learned that I didn't want to be like them in this aspect.
Okay.
Okay. Like, so, and that's, but that's like the beauty in things, that you have different experiences and not everything is so standardized. It's literally like, so what? You're just going to train students to be like all the same.
Yeah, robotic at that point. Yeah.
But when it comes to grading, maybe
Yeah.
You know, it's not unfair, because there were many times where I would get an attending of mine that graded me, but then some of my other peers would get another attending that's known to be harsher in grading. So we probably did the same, but they got a lower score
Okay.
just because the person grading was more difficult.
Yeah.
So
Yeah.
I can see how this AI could probably improve in the standardization of it.
Of grading on these things.
That there's like at least like a rubric in the system, so that everything is fair and like
Right.
kind of level, like the playing field is like leveled.
Yeah, that makes a lot of sense.
Yeah.
I mean, yeah, that would be the positive, I guess, of
Yeah.
that aspect.
So adaptive e-learning systems, AI can help personalize and the learning experience of students by adapting the content, pace, or difficulty of the curriculum. This is amazing. I am 100% for this,
Yeah.
because everyone is so different in their
Yeah.
ways of studying. When I read this, it's almost like a flashcard system. So it's like when you make an error on one thing, it'll save it and then it'll repeat it to you the
Yep.
next. And
Yep.
then like things that you get correct, it might not show up as often. So I think that's amazing. And
100%.
that's really going to elevate the way that people study.
Yeah.
Because let me tell you, I know I'm not alone. I really, when I was in medical school, I thought I knew how to study.
Yeah. Mario thought the same thing. He had to learn.
And I had to learn how to study.
Yep.
Because what I thought worked for me before was not working.
It's just too much what you guys have to learn.
Yeah, I was always a person in college. You would see me in my cubicle with my book open, and I would write down notes. Why? Because if I wrote it down, I would remember it. And man, I have like picture memory. I would be on a test and I'm like, I remember the page, I remember the picture and everything, because I was more visual. So I feel like that's why in notes, it was more visual for me to see my notes.
Yeah, yeah.
In med school, I was writing, and don't get me wrong, it was helping, but the volume
There's
was
so
so
much.
much that I could not. So I had
course.
to relearn how to study,
Yeah.
because maybe studying for biology is different from studying medicine,
Yeah.
you know? And then I realized that I would study my ass off, and then I would sit down for the exam, but I could not answer the question correctly because I wasn't able to apply my knowledge.
Okay.
So I had to change the way that I learned, and it was so hard for me to accept that I needed to do questions. So that's why a lot of people say I study by doing questions. Why?
Yeah.
Because it asks you the questions and it trains you to how to use the information that
Yeah.
you learned or whatever. So it's
a whole different way.
it's a whole entire, and no, and it's just a whole entire world. I'm like traumatized. I'm like PTSD right now.
She's right now going through a whole PTSD moment right now.
I'm like having like flashbacks of me like studying. But anyways, so another example of this is that AI can monitor the learning behavior and outcomes of students. So it provides them with tailored quizzes, which is kind of what we were talking about, exercises and resources that they can enhance their learning, retention, and application through like the material.
Okay.
AI in medical education can offer many benefits, such as improving the quality, efficiency, and accessibility of medical education, as well as preparing students for future of medicine that will be increasingly influenced by AI. I'm so afraid that I'm going to be like an older generation, and here's going to come a student and they're going to show me something and I'm going to be like, where's the floppy disk?
Exactly. Yeah.
Where's the floppy disk?
Dude.
And it's going to happen. I know it's going to happen, but
Happens to all of us.
But I really want to try and not be that generation where it's like, oh, you know, I didn't need that. You know,
Yeah.
I've been practicing for I don't know how many years and I don't need that. It's like, no, we need to stay with the times.
Yeah.
You know?
Yeah.
And it's hard because I practice community medicine. I'm not in academics. So usually when you're in academics, you have to
Keep up with it.
keep up with everything. And then when you're in the community practicing on your own, you have to like really take that initiative because if not, you're going to be left behind.
Okay. I mean, I see it. I see how and why. Yeah. Because you guys are isolated in that aspect.
No, yeah.
you know?
And when you're training residents, you're literally training the
Yeah.
world of now. So you're more
you have
versed
to.
into like what's new, what's
Yeah.
not, like grand rounds, like all these things.
Right.
So, and you can have that. You have access to that when you're a community physician.
But not as much.
But you need to have the initiative. When you're in that world, you're in that world. You're versed in it. It's almost like you could just be sitting down and things are just like falling onto your lap.
Yeah,
you
yeah,
know?
yeah.
But when you're a community physician, you're like looking, you're like, what's new? What's this? What's that? Yeah, don't forget me. What is that? What? Did they change that? When did they change that? Like that's how it is. And
Yeah.
so you have to be like the person to take initiative
Yeah.
to keep up with everything.
Makes sense.
Medicine, you're always learning. So AI in medical education also poses some challenges though. So it's not all like butterflies. It poses challenges and risks, such as ensuring the validity, reliability, fairness of AI tools, protecting the privacy and security of data, and maintaining a human AI interaction and collaboration. So it's important to integrate AI into medical education in a responsible, transparent, and ethical manner, which is with the involvement and oversight of relevant stakeholders such as educators, students, regulators, and researchers. So they're just saying, it's going to be a situation that maybe the way that I interpret this is that it's not like we're going to be helping the AI.
Yeah.
It's the AI is going to be helping us.
That's what
not the other way around.
Exactly. And I think that's the way to go with this.
Yeah.
It has to become a tool.
Yeah,
you know?
exactly.
So here are some ways that AI is, again, being used in medicine. Drug discovery, because we already did diagnosis and treatment. Like we've been talking about that for the last 55 minutes of how it's going to help diagnose and treatment, but also in drug discovery. AI can help researchers identify new drugs and treatments for diseases by analyzing large amounts of data, which would technically take researchers like today and years ago years to go through that data and like try to analyze it. Now AI algorithms can help identify patterns and relationships that humans may not be able to detect. Patient monitoring. So AI can help doctors monitor patients remotely and alert them to potential health problems.
Yeah, I think that's great.
That's pretty helpful.
And there's a lot of patients that come in to see a specialist and then they leave to their hometown. They don't live where that specialist is.
Right.
So I think that is actually very helpful that you'll have some sort of follow-up with that person and in a more helpful and efficient way than just like a telehealth from where you are.
Exactly. And then, I mean, there's even this example, which is even more in depth, that it's like AI algorithms can analyze data from wearable devices to detect changes in a patient's heart rate or blood pressure.
Yeah.
So that's pretty big.
Just wondering like who's reviewing all of that,
I guess there'll be a new specialty.
Yeah.
Maybe.
Yeah. Or
anything's possible.
more people trained there. Yeah. I don't know.
Or a new type of doctor that's only dedicated to that type of
medicine. Yeah.
Yeah. Anyway, medical research, obviously. AI can help researchers analyze large amounts of data, like we had said, for treatments and for cures of diseases. For example, they can help analyze genetic data to identify genes that may be associated with certain diseases, which is, there's so many freaking genes out there. If we could have a computer system that could just grab all of that and analyze it, there's so much that we could learn from it. And then there are also concerns about the use in AI, as we've talked about it. Some of them are that people worry that AI could replace human doctors and lead to a loss of jobs. That's like the first thing what we talked about in our first tangent. Others worry about the accuracy and reliability of AI algorithms, which is true. That's why I think like a human doctor is going to have to just like review whatever advice or anything comes from these AI things, because at the end of the day, they are algorithms, you know? And then despite these concerns, the future of AI in medicine looks bright and has a potential to transform healthcare as we know it, which I definitely agree with that. And then I wanted to point out some current schools right now that are using AI to teach students. And there's even, for instance, which I found awesome because Mario, my husband, graduated from residency from University of Texas San Antonio. It's exactly that one. It wasn't even Austin or Dallas or anything. It was from San Antonio. And they now have a dual degree program, which is MD and Masters of Science degree in Artificial Intelligence.
That's crazy.
That's freaking, I mean, it's smart as shit.
Yeah.
Because you know that it's leading to that, you know? So it's awesome, you know? UF, Florida. I've never even visited the campus, so I don't know. But anyway,
more of a University of Miami person. Yeah, no.
No, yeah, I know, but it's just Florida. Out of this list, it's the Florida one that we have. They also have integrated AI to it. Of course, Harvard. They have what is called AI in Medicine PhD track. because Harvard. It's a great Harvard. That's fantastic, obviously. Northwestern University's Feinberg School of Medicine. They have that integrated, as well as University of Illinois, University of Alabama, Birmingham.
Yeah.
Yeah. Stanford University and NYU Grossman School of Medicine.
So there's a lot of people that are already incorporating it.
And it's
I'm
only
telling you.
grow.
Yeah, it's only going to grow.
Yeah.
We're going to see a lot more students. I'm going to see a lot more students, and I'm going to be like, I don't know what I'm doing. Teach me.
Yeah. And then that's what I'm saying. If you're a student or you're thinking about going into medicine, check one of these places out, because the proof is in the pudding that AI will be part of medicine.
Yeah.
There's no denying it. There's no escaping it. So if you could go into a program that already has that started and they're building onto that, I think you're going to have an edge. I really think so. I mean, that's what I would do. If I were going into med school right now, which I'm really fucking not, at age 34 now. No. But you do you. Yeah, me, my life, no. But if you were in today's world, 2023, thinking about doing that, I think it's a good thing to look at.
Yeah.
Anyway, so that was today's episode. Hope you guys liked it. I keep doing that. Anyway, bye. See you in the next one.